Yeah, so there's many ways to prevent kidney stones. To start off with, we need to know that they're an issue, right? So typically for patients who form their first stone at an early age, I'll initiate a metabolic workup. However, if it's taken someone 60 years to form their first small stone, then we go through the general guidelines of increasing fluid intake. I typically recommend at least 80 ounces of fluids a day. And then we talk about, we try to tease out any at-risk factors in the diet. However, for patients who formed multiple stones or formed their first stone at a very young age, then we'll initiate a metabolic test. And that includes things like checking for hyperparathyroidism. That includes things like checking for a 24-hour urine to detect the amount of certain factors in the urine. And then, if making changes to the diet, to fluids, don't seem to reverse some of those at-risk factors, then there's medications that we can give to further lower the risk of kidney stones. There's lots of home remedies for preventing kidney stones. In general, one of the biggest misconceptions is that, if I take X, Y, Z, it'll shrink my stone or it'll cause my stone to dissolve. Typically, the majority of the stones we see are not the kind of stones that will dissolve over time. In a small percentage of cases, the stones that may be amenable to dissolution, that usually takes months for the stone to get smaller, right? So somebody with an acutely obstructing stone that's causing pain, overloading themselves on citrus or taking apple cider vinegar or sodium bicarb, most likely is not going to be beneficial. Things like cranberry juice, the data actually shows that it has very minimal effect in terms of preventing kidney stones. However, there are certain things in the diet that can help, that can be stone preventatives, right? Those include things like citrus, as well as foods that can change the acidity of the urine, things like apple cider vinegar or sodium bicarb. However, the important thing to note is depending on the type of stones that you have or the specific parameters of your urine, taking some of those things may actually worsen the risk depending on those other factors. Right? So it's important to get some testing beforehand to know what kind of stones you're forming, what are the parameters of the urine, and what may be putting you at risk, because you don't know if what you're doing may be helping or hurting. Acute kidney stone attack can have multiple complications. If somebody has poor kidney function, then blocking off one of the kidneys, or sometimes blocking off both kidneys if somebody's unlucky enough, can cause them to go into acute renal failure, where the kidneys just can't keep up with filtering the blood, and toxins can build up and make people very, very sick. One of the emergencies that we commonly deal with are people who have both a urinary tract infection and an obstructing stone at the same time. When that happens, the infection can build up behind that blockage where there's a high pressure system, and that means that antibiotics in your body's immune system can't get into the kidney to fight that infection. That infection can then get worse, and in some cases get severe enough to go into the bloodstream and make somebody septic, and that can become very, very dangerous from a medical perspective. Other conditions are things like causing long-term kidney damage, especially if a stone is blocking the kidney for many, many weeks or months. That can cause loss of kidney function. And I've seen patients who, come in with a completely defunctionalized kidney who say, "Oh gosh, I remember, 3 years ago I had a kidney stone attack. The pain eventually got better on its own. I never saw anything come out, but then lo and behold, the stone was there the whole time and has slowly killed the kidney over time." So I've seen a kidney that was more stone than kidney. Oftentimes in those cases, the kidney has very minimal function, and the stone can actually form a mold of the inside of the kidney itself, where the urine typically drains, collects, and then drains into the ureter. So it's almost like an inside cast of the kidney. And in those cases, typically the kidney, since it has such poor function, will remove the whole kidney instead of trying to break up the stone.